In our city, we have a tremendous opiate crisis. There are many kinds of crises in drug addiction. But why do we have an epidemic of opiates? What is happening here that is making opiates in epidemic proportions?
Well, I'm sure some members of this audience may know that we have a lot of opioid prescriptions being written. Louisiana is one of 8 states that the number of opioid prescriptions written exceeds the number of residents. There are 4.8 million opioid prescriptions written last year. We only have 4.6 million people in the state of Louisiana. So that becomes a real problem. Some of those people will become dependent upon the opioids. Some of them will transition to heroin. Mm-hmm. And that in of itself is another problem that we're facing with the strength of the heroin increasing because of it being laced with fentanyl.
Right. We'll talk. I would like you, doctor, to talk about maybe the chemical properties of these opiates. Tell people what kind of opiates are we talking about, because for us who say opiates, maybe somebody in the audience doesn't know, number one, what an opiate is, which kind of drug it is that's out there that's so readily available.
So our opiates are basically the best form of pain management that we have today in terms of treatment. The problem is with it, as they had mentioned, is that they're very high in dependence rates and tolerance rates as well. And one thing that is interesting, as you had mentioned, is that each of these medications are very, very similar in structure. And I think the thing to understand is that the stigma between the agents is very different. If somebody says they're on heroin, they're looked on much differently than somebody that says I'm on Tylenol with codeine or something for a cough. And so even though the difference in structure is very small, the opinions of these agents are very, very different. And it's important to know that all of these agents are very similar. They're in the same class, and they all have the same type of effect. Some are just more potent than others, but they can still have...
Are we in that much pain?
I think opioids work well for acute pain. However, for chronic pain lasting longer than 5 days, they don't work well. If you look at the prescriptions written, over half of the opioid prescriptions are written by family practitioners. But the ones who prescribe the most are pain management doctors and specialists such as orthopedics, neurosurgeons. Again, over a period of time, chronic opioid use actually does little to treat pain. It actually increases the perception of pain by a condition called hyperalgesia. Mm-hmm. You cannot tell me or show me why somebody with chronic back pain is getting any benefit from opioid therapy. It just does not work that way. There are so many other things we can do for chronic back pain or chronic pain rather than prescribe opioid therapy long term.
And the way they work in your brain, they work 2 different places in your brain. In one place in your brain, they affect your emotions. They cause you to feel relaxed and happy, and it's a very pleasurable feeling. In the other part of your brain, they can work to relieve symptoms, unpleasant feelings like pain. And we also find these in cough medications. They can suppress the unpleasant feeling of a cough. So most of the time, patients take these medications because they feel unpleasant feelings and they want those feelings to go away. So you take an opiate to eliminate unpleasant feelings, and then they cause you to feel better. And then the drugs, they only work for, depending on which one you take, they might last for 30 minutes or an hour or a couple of hours, and then the feelings start to return back to normal. The unpleasant feelings come back and the pleasant feelings go away, and so you take another dose. And
well, unfortunately, I think society's only noticed opioids because recently we've started to see people die who have had access to people in power. Mm-hmm. Addiction's been with us for many, many years. People have been dying of addiction for many, many years. And people who've been treating people with addiction have always seen that addiction crosses every ethnic, class, culture, nationality, gender, every line you want to draw between people, addiction cuts right across it. And there's no difference. There may be a difference in what drug one group uses than another because of culture and accessibility, but really addiction is found in the same 10 to 20% of the population, regardless of what population you look at.
Whatever you take out of this meeting, remember 10 to 20% of the population is addicted, right? They have a brain disease. We continue to talk about the opioids. We continue to talk about the pill mills. We continue to talk about the drugs as though they're the bad thing. And I'm not saying they're not. We do have an issue with physicians overprescribing. We have more of an issue with patients asking for it over and over. But we have to go back to what Dr. Wetsman was saying, that 10 to 20% of everyone in this room has a brain disease. So what are we doing to solve the brain disease?
When you don't have enough dopamine in your reward system, you don't have enough of anything. And everyone around you is wanting the last little bit of what you don't have enough of. And it starts to feel irritated. You get irritated. So you start to look for more dopamine. Any low dopamine mammal will. And when you find a source of dopamine, it doesn't last very long. You get a dopamine high followed by a dopamine crash. And so because it doesn't last very long, you're always discontented. And because you don't have enough and you're feeling irritated, you're always looking around and never sitting still, constantly looking for that, and then not getting satisfied, you could say you feel restless, irritable, and discontented. And those are the words actually used by a doctor in the 1930s, Dr. Silkworth, who wrote still the best neurobiological description of this disease.
For a young person. You have 25 years in recovery.
Yeah, I do. And you're right. I do think it starts in the home. I do think that you are modeling behavior. I had multiple people in my home using drugs and alcohol. I had friends and family members using drugs and alcohol. I think that leads you into it, but I still go back to what Dr. Wetsman says. 10 to 20% of us are going to be addictive. There's other people that grew up in my household, cousins, uncles. They didn't have an addictive personality. They did pick up a drink early, but it didn't lead to addiction. And so I still think we have to go back and ask ourselves what's going on with the brain. We're just now starting to study it. We're probably still another 20 years behind where the mental health field is, and the mental health field is still struggling with understanding the brain. It's still one of the most complex organisms to understand, and the research that is out there today, I think it's going to change even more in the next 20 years in terms of what's the biology of what's going on in the brain, and then how do we treat that individual. And so I still go back to we need more research to understand what's the best way to treat people. We treated people 25 years ago totally different than we treat them today. At least I feel like we did. In terms, it was primarily 12-step based approaches that I got sober through Alcoholics Anonymous, so I still go to meetings and love it, but no one ever talked about biology. Very seldom talked about, assessments and taking a look at what's going on, both co-occurring disorders. Do you have other brain illnesses going on like depression, anxiety, schizophrenia that can also amp someone's ability to reach out to drugs and alcohol to solve those problems? So I think we're just starting to scratch the surface. Right, so there's a combination of things that really need to happen for us to really get that use pattern in this country, and not just talking about it as politicians, but really actually putting money behind that and research behind that and taking it seriously. I love what happened in Atlanta. You were talking about it earlier, but I still go back to how much are they really putting into this disease. If you take a look at the prevention programs in the United States and how underfunded they are, it's like, how serious are we about this problem? If you take a look at the research studies that are going on about this disease compared to other significant diseases, if you think about it, how many people did you say were dying every day? It's
91 people.
91
There'd
people.
be an uproar if it was any other disease.
If 91 people were dying of anything else in this country, there would be an uproar in this country.
And
we would spend $1 trillion to solve the issue, right? How much money have we spent overseas in foreign wars just in the last 10 years, right? Can't we spend a similar amount of money to try to find out what's the best way to prevent this illness and treat this illness?
And
A few years ago, it used to be that 2/3 of the opioid deaths were from prescription opioids, and 1/3 was from heroin overdose. I think we're seeing a rise in the heroin overdoses equaling that of prescription opioid overdoses, and I think part of that is because it's now being laced with fentanyl or carfentanil. Fentanyl is 50 to 100 times more powerful than morphine or heroin. Carfentanil is 10,000 times more powerful than morphine. So it's being mixed with the heroin. It's a demand because it gives people a very good high, but it is playing Russian roulette when you use it. It's easy to smuggle in. A brick of carfentanil could supply, you know, a state for a year, because all it takes is a little sprinkle here and there. There are about 3,000 to 6,000 pharmaceutical manufacturers in China that are unregulated that are producing substances like fentanyl, susfentanyl, and carfentanil, and it's getting into the supply of heroin here. And the downside of that is that we may not be able to resuscitate those people. What I see in the emergency department is people who overdose and survive. And we need to get those people into treatment. You know, I am seeing a lot of young people who become addicted to heroin. I see professionals.
Right.
So again, it goes across all class lines, socioeconomic status. So it's no longer jazz musicians and derelicts on the street. It's, you know, everybody it's affecting this.